Northwest Health Foundation has been around now for 25 years. On this special anniversary, we wanted to take a look back and celebrate how we came to be, all we've achieved, and how we continue to strive to fulfill our mission.
Northwest Health Foundation was created from the sale of PACC, or Physicians of Clackamas County Health Plans, in 1997 for the purpose of really extending the values of PACC to provide health care for all people. Northwest Health Foundation initially did funding for health care services. Our very first grant was to Virginia Garcia Health Centers. That was important for many reasons because it took into account the PACC background of trying to reach all people in need.
People would submit grant requests in those categories of health funding that we were interested in, and we would issue grants each year to those organizations, and there would be a one-year grant for a one-year project.
And we sat and looked and said, you know, at our size, we're never going to make a difference in healthcare services.
We were really struggling with this question of what is the role of philanthropy? Is philanthropy there just to provide some funding for some projects, or is philanthropy, do we have a deeper mission and purpose, which is to try to have a positive impact, to do good for people's health, for the health of the people of this region?
And that was basically what got us into the public health thinking and put us into the social determinants of health.
And that having an impact on those determinants, and therefore then working with organizations, working in those communities who had deeper lived experience, knowledge in those communities, was much more important than us trying to second guess ourselves and think about what should we fund this year. Go to those organizations that are working in those communities and ask them.
The field of philanthropy as it exists in this country is only 100 years old, and it's actually 102 years old. And I like to say that for 101 of those years, communities have been telling us, give us general operating resources, trust us, believe in us, let us do our work. And I do feel like Northwest Health was one of the first and best listeners. The whole report was commissioned by Northwest Health Foundation and the Coalition of Communities of Color that showed that while 33% of the state of Oregon were people of color, less than 2% of philanthropic giving was going to organizations led by and for people of color. And you just can't look at that data and pretend that you haven't been part of it.
Like many organizations that are working to advance racial equity, I think we got there through a mix of inside and outside pressure and conversation.
I can attest, dollars to donuts, that every single person who influenced the foundation, worked here, partnered with us, challenged us, served on our board, helped make critical contributions in our journey to racial equity. And just like driving is not actually getting from point A to point B, it's a series of constant, ongoing corrections. That was also our journey.
When we realized that we needed to be in deep partnership with the people most impacted and be in funding relationships with those folks, it was a big transition for the organization.
And so it took us a lot of work to rethink our role in the community, our mission, who we serve, and the outcomes we want and how we get there in order to earn the trust of those communities.
So as we were trying to focus the discussions around equity, I think we started with concerns about racial equity, and we were looking for other areas of concerns to focus. And the subject of disability was surfaced, and the first reaction was, well, we're just not well enough equipped to address that. That doesn't mean it's not worthy of concern, and in fact, that's often an equity problem that a community is neglected because they're hard to understand or their problems are hard to solve, and we like to pick off problems that we understand better. A role the foundation could play would be to shine the light on those concerns, to promote discussion around that neglected area.
I'm really proud of the work that Northwest Health Foundation did, building incredible coalition of both LGBTQIA and people of color who live with disabilities to build out an entire framework to talk about the ways that philanthropy needs to change to center all of those communities. So that work is something that foundations all across the United States look to and listen to and deploy as part of their work.
So Northwest Health Foundation right now is trying to embrace all of the tools in the toolbox. We recognize that we have unique resources in the form of 501c4 dollars that can really meet head on this acknowledgement that it is elected officials and it is voters that are deciding high-level policies that are driving access or lack of access to health. And so this new chapter that we're in is really embracing and acknowledging that who we elect and the policies we decide at the ballot have a real impact on people's everyday access to health. Northwest Health Foundation exists to advance the health of the people of Oregon and Southwest Washington. We fund and support community-led organizations. We use our influence to change the practices and the policies of governments and civil society. And we think about an infrastructure and an ecosystem that supports community-led organizations and the work that we're trying to do to advance health.
The list of important public policies that they have been really partnering and supporting with the community to advance that has had profound impact across the state is too long for me to share.
My hope for the foundation is that we continue to be forward-thinking, that we continue to be unabashed about the way that this work ought to be done, and that Oregon and Southwest Washington truly does become a healthier place for people to live.
Northwest Health has always been small but mighty.
Equity and justice have always been part of the DNA of Northwest Health Foundation.
When I think about the foundation, I'm reminded of the saying that none of us ever arrives alone. I think about all of the individuals and the community partners and the leaders that helped shape us and made their contributions on our journey.
Whether it's our last 25 years or our next 25 years, what will always drive us is a passion and belief for what is possible.